This is a Fox 13 News special report.
It's been more than 4 months since the lives of families across the state of Utah were turned upside down.
Therefore, I'm announcing today a soft closure of all of Utah's public schools.
For months now, COVID-19 has changed our daily routines from one-on-one time with teachers and classmates.
Just review our 7 habits and talk about what they are and why they're important.
First things first.
To distance learning at home.
I'm tired of fighting. She's done. She's tired. She doesn't want to do this.
And with a new school year right around the corner, there are concerns about how safe class will be for students and teachers.
Asking kids to sit next to each other for 7 hours a day with just a mask is not enough protection.
It's gonna feel so different, and how I'm gonna have to kind of teach completely differently, that I don't really know how it's gonna work yet.
Tonight, Fox 13 News is looking to give parents some guidance and peace of mind in the decision-making process so your children can go safely back to school. Good evening and welcome to this Fox 13 News special presentation.
Over the next 30 minutes, we are going to look at the factors that play a big role in safely returning your children to the classroom.
Fox 13 News is helping you to prepare for whatever lies ahead. We hope to give you ideas about these crucial next steps before school starts.
Fox 13's Amy Nay has been talking to families, also experts, about some solutions, and joins us tonight live in studio. Amy.
Bob and Kelly, this is an important topic for me and so many of our viewers, of course, right now, as we all try to navigate through this the right way for our children. To begin tonight, we take an in-depth look at the challenges local families are facing right now, and some who are looking into what other options may be out there if the choices offered by their school just don't work for them. We start with the parent dilemma.
It seems like no matter what choice is made, no one's going to be happy.
Amanda Funai is the mother of 5 sons, 4 in the Salt Lake Public School District. Her newborn, not yet of school age, born just 4 weeks ago in the middle of the coronavirus pandemic.
It's been a challenge, you know.
Pregnant this spring with baby Jack, she and her husband, both professors at the University of Utah, would try to facilitate distance learning for their boys, ranging in age from kindergarten to 7th grade.
So that's kind of a hard dynamic where you're not just the parent, but you're also trying to enforce all the schoolwork at the same time, plus trying to get all our work done.
She says it was quite a juggling act.
You know, the kids would have Zoom meetings, we would have Zoom meetings, both me and my husband. You know, we can do about 2 or 3 Zooms before our bandwidth will, crap out.
For some, distance learning worked, but for 8-year-old Logan, it was frustrating.
We would check over his work, and he would be like, "You can't tell me to change that. You're not my teacher."
Something she says they'll still face this fall, when in her district, they still don't know if they'll be solely virtual or a mix of at home and in the classroom.
There's good things about it and bad things.
Logan's heading into 3rd grade.
It was hard to understand how my teacher wanted us to do things. It was kind of chaotic.
Big brother Andrew is going into 8th grade.
It was really different. Some of the classes were harder to do, and some of them were about the same.
He says being stuck at home was the hardest part.
We're getting a bit stir crazy, but it's been really fun.
He liked online classes, but says it's better with friends, so much so that he says he's willing to wear the mask he doesn't enjoy.
I think that masks should definitely be worn, but I tend to get claustrophobic when I wear them. But I'll make do, I guess.
I want to see the kids wear masks, especially the older kids.
Amanda also hopes social distancing and hand washing is a priority if the kids do go back, something Salt Lake is still trying to decide.
I know that the teachers want to be safe. And obviously we want the kids to be safe too. My dad and my brother are both middle school teachers, so I know how they feel about being back with all the kids, but it's hard on parents to have the kids home, and it's hard on the kids too.
Fearing they're not getting the education they need.
I'm transitioning my class online for the fall right now, and I have university students who will do it, hopefully. It's different when you have elementary school students and you're trying to get them to do everything online. There'll be gaps even with a really good curriculum.
Amanda says she has concerns about her newborn in this COVID age and doesn't want to expose him, but balances that with the belief that for her older boys, it's better to be back in school.
My husband has had colleagues who have gotten COVID. One of my students last semester did. So it's there, it's real. We're trying to make the best decision to keep everyone physically and mentally healthy, and it doesn't seem like there's a right choice in there.
It is such a nightmare. We have been just frantic trying to make plans, second guessing ourselves, waiting for information.
Rachel Day is like many moms here in Utah, trying to decide what's best for her kids in the upcoming school year.
We are really worried about sending our kids someplace where we just don't know if it's going to be safe or what the arrangements would be to keep it safe.
In Rachel's district in Salt Lake, there's still no final plan as to what school will look like for the kids.
Communication has been slow with our district. We're having to start to think about other options now.
Like hiring tutors or forming a co-op teaching group with other parents in the neighborhood.
I think there's an idea about having moms take a day with a group of kids each that will give them the social interaction, some educational opportunities, but also be in environments that we know are safe.
Let's see where I can fit this.
Rachel has 2 children, her son William starting 2nd grade.
Those are just options we're beginning to talk about as we feel less confident that the schools are in a place to start in a couple weeks' time.
I'm William. I have another magic trick I want to show you.
William's entry into his school's virtual talent show, part of his at-home learning this spring.
Pretty interrupted.
He hated distance learning.
It did not work out. I did not like it.
And his mom agrees, saying it was hard to keep her son on task with his assignments. Part of why she's now looking into other options.
I think the spring was just a huge challenge for everyone, and we're basically looking for alternatives to that.
And Rachel's not alone. This is a trend across the country where parents are banding together and hiring private instructors. Facebook groups like Pandemic Pods or Micro Schools are helping families connect with thousands of members. But it can come with a cost. On the site Teacher to Go, 3 hours of tutoring 4 days a week would cost $480 a week, widening an already present gap. Education equity is an issue the nonprofit Waterford.org tries to address, offering free pre-K education online to families in Utah since 2009.
The children get 15 minutes of personalized program every single day, 5 days a week.
Preparing 4-year-olds for kindergarten and beyond. But spokesperson Kim Fisher says for many, success with online learning comes down to whether or not they have a computer and internet access.
Those who have it have been able to continue their learning progress. Those who don't, they're getting left behind. That technology gap has to be addressed in order for us to move forward with our children and their learning.
Can you tip it over? Show me the back.
As for Rachel and William, they're trying to decide what's next for them this fall.
I think just trying to figure out what could work, what are the opportunities for kids and parents, and try and muddle through it again as we did in the spring, looking for an alternative to that.
Oh, lots to think about. Now, in Salt Lake, the board decided last night to start the school year with kids at home. There are some programs that found a way to operate through this pandemic, offering options for working parents. We'll profile one local program as they share their lessons learned. That's coming up next.
Amy, also coming up, one of the biggest challenges facing districts all across the country is how to handle children while on a school bus. We'll show you some ways districts are changing the bus system.
An anxiety-inducing fall is ahead for parents as a new school year looms. Coming up, we show you the specific scientific number any parent can find online to decide whether it's safe for your kid to go back to school.
Welcome back, everyone. Glad you're with us tonight. We know many parents and grandparents are concerned about the upcoming school year. Chris Conti shows us a specific scientific number that many experts believe is a key metric to measuring safety.
It's daunting for sure, the decisions that you have to make.
A summer of social distancing is giving way to a fall of uncertainty for Courtney Knopfsinger and her family.
We had no idea that we would still be battling this in July heading into the next school year. It's just absolutely mind-blowing.
Courtney has spent the last few weeks agonizing over her daughter and the start of the coming school year.
It's been a little bit lonely for me.
Like so many students, 11-year-old Presley Knopfsinger wants to go back, leaving families across the country at a critical crossroad.
But we're fearful, especially when the data keeps changing.
So where can parents turn for guidance? MIT has created the COVID-19 projection machine. It gives parents an interactive map to work with. As you scroll over each state, you can see current case numbers. Pay attention to this one number, though, the positivity rate. Health experts say once a state's positivity rate goes above 5%, parents should take note.
Parents don't like to hear me say it, but we will be undertaking a whole series of experiments across this country.
Dr. William Schaffner is one of the country's leading infectious disease experts. He wants parents to be flexible if cases in your district start to rise.
That school system is going to have to figure out if there's a trigger point there where they call a timeout and everybody stays home and the learning becomes virtual.
Dr. Schaffner also says in-person learning will be more successful if parents model good behavior at home. Wear a mask in public. Show your kids what social distancing looks like.
If you do that in your family already, then it'll be easier for the child to understand what's happening.
Oh, that was sweet.
As for Courtney Knopfsinger, she's decided to let her kids go back on a hybrid schedule and is emphasizing safety.
Just keep coaching them, keep putting the thoughts in their heads that they have to wash their hands, they have to wear the mask going in and out of the building, and why.
Like so many other parents just trying to get safely back to school. I'm Chris Conti reporting.
To reiterate, the key number for parents is the positivity percentage. That is the number of COVID-19 tests that actually come back positive. Now, some health experts find it concerning when that percentage is above 5. Tonight, Utah's percentage is 9.9%. If you'd like to see the tracking map, go to fox13now.com and click on the Safely Back to School tab.
As schools grapple with how to proceed next month, there is one program that made last-minute adjustments to open during the pandemic. Here again is Fox 13's Amy Nay.
Good morning. That looks awesome. You ready to go in?
It's a bustling scene here at the Jewish Community Center on Salt Lake's east side.
Good morning, Malcolm. Hi, Brooklyn.
Counselors in this newly transitioned child care program welcome the kids in a new curbside drop-off, part of pandemic measures now in place.
And you've got the temperature?
But the kids seem unfazed, clad in their colorful masks and ready for a fun day.
We call it the summer care at the JCC, and we either have our early childhood group or we have our youth summer care.
Carla Pardini is the JCC's director of programming.
We had a full camp for the summer of 2020.
Something they're known for among parents, typically hosting several hundred, but thanks to coronavirus, like so many other programs across the country, summer camp had to be canceled.
We had to go to what the Department of Health calls emergency conditions of operations, and everybody just pushed their sleeves up and, made it work.
They scrambled to put new safety measures in place, restructure how they would handle the kids, train their teachers, and then reopen with something different and to a smaller group.
It's limited. It's very limited. For an example, we had about 230 children registered in our older elementary aged camp. And now we have about 50 children in that camp.
Important. Very important.
Parents in the program say it's just what they needed.
Without it, I can't work. And we have, both my husband and I both work. And it felt safe enough to do that.
Daily temperatures taken.
Have you experienced any of these symptoms?
Questionnaires, quarantines for those who traveled out of state, and masks required for everyone inside. All measures that helped put moms' minds at ease and still allowed the kids to be kids.
I think they're doing a really excellent job. My kids are very happy here. They have a lot of fun. They feel very social. They feel very much like they're at camp.
There have been daycares reopen across the country, enacting new, similar safety precautions. But according to the National Child Care Association, out of the 244,000 licensed child care facilities and in-home providers, 60% were forced to close during the pandemic, and 30 to 50% are expected not to reopen.
This has been a really good experiment for us. At first, we felt really afraid and scared to pull this off, but it's gone so well that we are really excited for the school year, and it's been a really good summer.
Get that in, Zachary. Thank you.
Using the lessons learned to help operate their early childhood center, preschool for kids 5 and under, and their youth programs for 6 to 12-year-olds.
We know we can do it. We've done it for June, July, and August coming up, and we know we can do it.
Recognizing some families won't come back.
We do have a lot of folks that are nervous and afraid, and all I want to say is we understand. We understand that. We're not trying to convince anybody to be here. We just want you to know that. And we can't control, maybe we will get an outbreak. We can't control that. But we know that we're doing everything we can to prevent it as much as possible.
Yeah, look at the Jewish Community Center there and their summer care program. Now, if you'd like more information on what's available, there's a great place that you can turn that's full of resources. This one's really neat. Check it out. It's called careaboutchildcare.utah.gov. It's a website run by the state's Department of Workforce Services and the Office of Child Care. Lots of important information there. We can link you over from fox13now.com. And coming up, this pandemic and its impact on our mental health. What to watch out for in your kids, and the questions that you should be asking to start the important conversation.
Also ahead tonight, special needs students in Utah are facing a tough school year. Tonight, the issues some students may face and how experts say families can help.
So many things to think about right now, and parents may be wondering how their students can ride the bus safely.
Experts say most fully loaded school buses can transport about 77 students. Now, cramming them into that enclosed area would be a perfect place for COVID-19 to spread. So the CDC is advising bus companies to have only 1 student per bench. But that reduces capacity on some buses to about 12 children, meaning school districts would need to run double or triple the number of trips each day.
The group Alternative Behavioral Strategies says parents are wondering how school will go for their special needs children. They say those children typically need consistent, one-on-one, hands-on teaching. And things like social distancing, wearing masks, online learning, also split schedules may be very difficult. The group says it will be a challenge schools do need to address to ensure a safe learning environment.
It is a tough situation. And the idea is to really understand the resources and figure out how can I get the consistency, how can I get the intensity of the learning opportunities that my child needs.
Alternative Behavior Strategies says parents should reach out to their children's school and behavioral health organizations to find an individual plan for their child.
Many parents are trying to decide what's best for their child as they ponder how to get them safely back to school.
We took those concerns to pediatrician Monica Wanacott at the Granger Clinic in Riverton. Now, she does support recommendations by the American Academy of Pediatrics, which just last month says students should be physically present in school.
We're starting to understand that kids aren't amplifying the virus like influenza is. It seems to be transmitted different, and how it's acting in them is different.
Based on those frameworks we've been given from the state, we feel comfortable moving forward with significant restrictions and regulations in our schools.
Spokesman there for the Granite School District says school will be very different from when students were last in class back in March. Assigned seats, desks spaced far apart, auditoriums used as classrooms, also outdoor spaces utilized. Dr. Wanacott suggests parents talk to their children now about the importance of taking safety measures.
She has 3 suggestions. 1, go back to the basics. Eat healthy, exercise, and get the sleep you need. 2, practice proper etiquette, such as coughing into your elbow and staying home when you're sick. And 3, wear your face mask correctly, covering your nose and mouth, and be careful about where you touch it or set it down. And send a second face mask to school with your child so they can change it at lunch.
And that's a key element, to talk to your children about the measures they can take to stay healthy. Those are ways to empower your children instead of scaring them.
All of this can cause stress and anxiety, and something that Fox 13's Amy Nay reports school counselors are preparing to address.
We're prepared to provide support to students and families whether we come back or not.
Stacy Lindsay is the counseling specialist for the Salt Lake City School District.
We are expecting that there's going to be a lot of need when we come back to school.
Students and families dealing with stress, anxiety, depression, and possibly trauma.
As counselors, we're just trying to plan for whatever scenario comes up. We have essential functions of counselors, and that's to teach social emotional skills to students and also to provide support when students are having a really hard time. And we're prepared to do those functions whether we are back to school or whether we do that remotely.
She says her team of counselors and social workers in her district and across the state have been gearing up for the increased need they expect in mental health assistance, but says that parents should really start a conversation now. The Child Mind Institute suggests parents ask their kids a few key questions to open the line of communication when it comes to mental health. What was the most interesting or exciting part of your day? What was the most frustrating or boring part of your day? Is there anything you're especially looking forward to this week? Is there anything you're feeling worried about this week? Who are your friends, or who would you like to hang out with? Recognizing we're all living through unusual and stressful times.
It's a hard time for everyone, and I don't think we can get around that. As counselors, we talk about something we call it radical acceptance, and that means accepting what is and what you can't change, and at the same time trying to be gentle with yourself and with the situation, and realize that as humans, we have evolved so far because we are flexible, we're nimble, we're collaborative. We can work together to solve these problems.
Resources available include not only your child's school counselor, but also places like the Odyssey House, now working in partnership with local school districts. Or you can access therapists 24/7 on the Safe UT app.
Nothing to be fearful of or ashamed of. Like, we all need help at times. And we do have resources in our community and plenty of people who are willing and eager to help you. If you feel like you or your child is going into a crisis, definitely reach out. That's what we're here for, and we want to help.
Now, Centers for Disease Control and Prevention has an entire section at cdc.gov when it comes to kids and their mental health during this pandemic. They offer free services, emergency 24/7 help, and more. Bob and Kelly, experts suggest that we take this time to reassure our kids that they're going to be okay, and of course, we'll help them navigate their way through this journey that's certainly new for all of us.
Absolutely new for all of us, but we really hit on some key points that families can now talk about together. Thank you for joining us tonight as we help get your children safely back to school.
QuickCast is next.